Well, I want to thank the students from Neelin High School for submitting the question about quality health care and access to health care. I have a lot of affection for Neelin because that's a school where I student taught when I learned to become a teacher, and so I want to send a shout out to those students there. Health care in our system I think the system's pretty good, but you've got to get into the system. And the problem we have in Manitoba is the delays are the longest in Canada. So people are waiting a long, long time to get into emergency care, for example. The longest waits in Canada are in 4 hospitals in Manitoba of the top 5. So you would wait an average of about 7 hours to get health care at an emergency room. You could travel to Vancouver and back in less time than that, so that's not good. We're going to set up a task force. In our first 6 months, that task force is going to look at what has worked around the world and around the country to shorten those wait times and make health care available to people in a reasonably fast manner. It's important because the NDP government promised they'd eliminate what they called hallway medicine, and what they created instead was highway medicine, where lots of families are actually driving to other communities to get health care, or even driving to the United States to get tests done or to get procedures done. That's not fair and it's not right. So we want to shorten the wait times, and we also want to do a really good job of recruiting doctors. We've exported more doctors to other provinces than every other province, and it's partly because our taxes are really high here, and in fact the New Democratic Party has a plan to make them even higher. So that would mean that we'd be exporting our experts, and that's not good. If you need a doctor, you don't want to drive all the way to Saskatchewan, Alberta to see one. So we need to have a better plan to recruit our doctors and help them to find Manitoba their home and help them to stay here. And finally, on the issue of ambulance fees, I wanted to mention that our ambulance fees are the highest in Canada. We're committing to lower our ambulance fees by 50% in our first term, because you shouldn't have to pay $500 if you're hurt or sick to get into an ambulance. You don't need a bill that big. What you need is to be able to get your health looked after if you're hurt or sick. And everybody who cares about anybody else in the province knows that nobody deserves to have to go broke getting into an ambulance.